Dr. Anjali Venkateshwar and will be introducing today's speakers on behalf of Biomere, a preclinical CRO with locations in Boston, San Francisco, and China. Welcome to the three-part webinar series on preclinical studies to support IND filing. Each webinar will have two segments with a question and answer session at the end of the second segment. Our speakers today are Dr. Sol Bobst and Dr. Harriet Kamendi. Dr. Bobst is currently the president and principal advisor of Toxi Advisors and is a board-certified toxicologist with adjunct academic appointments at Wright State University and the University of Texas Medical Branch. His expertise includes food safety, forensics, risk assessment, litigation support, drug and medical device approval. He has been a contributing author and editor of several books and has chaired study committees with the American Chemistry Council. He received his PhD in toxicology from the University of Texas Health Science Center in Houston. Dr. Kamendi is a consultant working with private companies on chemical risk assessment. She started her career at AstraZeneca, where she served as a study director for multiple projects aimed at developing a combined pharmacokinetic, toxicokinetic, toxicology, and safety pharmacology model for screening new drug compounds. After 5 years at AstraZeneca, she started consulting on environmental chemical risk assessment for private companies and for the state of Maryland. Dr. Kamendi joined Emergent Biosolutions in 2015, where she served as the resident toxicologist and non-clinical development manager. She received her PhD in pharmacology from Howard University and completed postdoctoral training at George Washington University. The title of today's talk is Pharmacology and Drug Distribution Studies to Support IND Submissions. So, without further delay, it is my pleasure to introduce Dr. Sol Bobst and Dr. Harriet Kamendi. Let's begin with you, Sol.
Thank you, Dr. Anjali, and great to be presenting again with you, Dr. Kamendi, on webinar number 2, Pharmacology and Drug Distribution Studies to Support IND Submissions. You can see our contact information here if you have any questions or want to follow up on the information presented today by either of us. Here is an overview of what we will be covering today. And these are the types of studies that you will see in IND submission. So we are going to go over these high level for a global audience so that you understand what is expected when you're applying with the FDA. Now, you'll find that a lot of these are probably very similar to the other markets globally that you submit to. So you can pay attention to how they may be similar or different and ask us if you have any questions. But the main thing is, again, seeing that there are resources and advice, because we're showing you a lot of information in a short amount of time. But that information has guidance and instructions on how to go through it, if you know where to find it and how to assess it. And we'll give you some examples of that today. And here, this first link is FDA guidance on some studies. This particular one says sexually transmitted diseases, but it's actually wider than that. And more specifically, there are tests around the drug efficacy, which is important to be aware of. And this is a link that can bring you to that guidance document, which you can download and review at a later time. So around these topics of clinical pharmacology, the FDA describes information that they need is what the body does in the drug. And that's the traditional ADME, or absorption, distribution, metabolism, and excretion, or the pharmacokinetic and pharmacodynamic profiles of that drug. Now, these can vary between different compounds, because maybe you have an intravenous drug, maybe you have a drug that's delivered dermally or orally. So you have different clinical pharmacology and backgrounds that you're probably need to look at. The ultimate goal is to get the right drug to the right patient at the right dose and at the right time. What's really exciting about drug development in the 21st century is the exploration of potential personalized medicine, or can we use information like pharmacogenomics and individual genetic profiles to make a direct drug delivery? That's the hope, to help patients with very rare diseases. So how do we achieve this goal? Well, we have to look at a whole plethora of studies to assess safety, performance, and make sure we deliver the right dose to the right person at the right time, in the right place, amount, process, etc. So there's a lot of information here: clinical pharmacology, the in vitro studies, biologics, especially around if there's an immune reaction. So I don't expect you to digest this all at once. But more specifically, we really need to focus on understanding what is the impact on the liver and the kidney. That's the most important aspect of understanding absorption, distribution, metabolism, and excretion. Renal or drug-induced liver injury can be very common and major issues in the progress of a drug. So really understanding renal and hepatic impairment is important. Also understanding if your drug has a mixture or if there's any food effects, how those issues come out. So these are just some highlights. Obviously, these pharmacokinetic studies and understanding healthy individuals versus patients, how the different performances, that's very critical information you need to plan for. So related to this is also understanding specifically what your drug does. What are you treating? What is the disease? And this is where there needs to be information on mechanism of action. And there's a lot of information on this slide, I admit, but I just want you to focus on what's in the red, because this is very important and will make the difference between will your IND submission be successful or have problems. And that is, the mechanism of action must be discussed at various levels. At the cellular, receptor, or membrane level, the impact of the pharmacological system it targets, and then the overall impact on the body. When we're looking at biologics like CAR T therapy or immune treatments, there's the question of targeting the cancer tissue, but then also how the body might react to the biologic itself with, for example, hypersensitivity. So mechanism of action is really taking a holistic understanding of everything the drug does in different places. And all this other information just gets at the different details of how that's done. Now, there's guidance here that can guide you through, and you can study this at a later time. But when you're understanding mechanism of action, you must show that you understand it directly, very well, and it be well documented. Now I'm going to introduce Dr. Kamendi, who will talk about the target product profile sheet here and some other information that helps break down the type of case profiles, the issues that you're going to address as you build your IND application to deliver the FDA all the information they need. So Dr. Kamendi, I'm happy to hand over the presentation to you at this time. Thank you very much.
Thank you, Saul. So I'm going to continue from here by reviewing the things that we must be cognizant of as we start the journey. So a target product profile is a worksheet that you develop that characterizes the properties of the compound that you wish to develop. So the most important things are to describe the product and its mechanism of action. It is also important for you to define what the indication is. And the reason you want to define the indication is because you want to know the disease you're treating, how much drug you might need to treat the disease, so how much drug you need, the duration of dosing, as well as the how many times you would dose, the frequency of dosing. So you want to understand the disease, you want to understand how you're going to use this drug. Is it going to be preventative? Is it going to diagnose, or is it going to relieve the symptoms that you're looking at? You also want to understand how many indications your compound could possibly have. So by doing this, you are beginning to define what your efficacy models should look like. At the same time, you want to understand your disease population. And why is this important? Because you need to define the kind of patient population that you will be looking at. This is important because when you do your animal testing, you must do it in an animal model that is similar to the human population you will be dosing this compound into. Remember always that when you're doing a risk characterization profile, you're trying to ensure that you provide enough detail to the FDA before you do any clinical dosing. And that is primarily to assure them that you're not going to harm anybody with the drug that you're developing. So the patient population, for example, if your drug is intended for children, then you'd have to test your drug in young animals rather than in the normal animals that we use for adult dosing. You also want to understand the clinical pharmacology. And by that, we mean that you want to understand the pharmacokinetic characterization of your molecule. That's your absorption, your distribution, your metabolism, as well as your excretion pathways. This is important because if you understand the properties of the chemical you're dosing, when it goes into the body, you will be able to determine whether it's only necessary to test the test article itself, or it's also important for you to characterize the metabolites that will be developed as you dose the drug into individuals. You want to know the dosing and administration, and that includes the dose, how much drug will you give, what's the interval or the frequency of dosing? Are you going to give it 2 or 3 times, or just a single dose is okay for that particular indication? You want to know what route of administration is out there, how you're going to dose that drug, 1. And 2, is there anybody else who has done work with this chemical in the similar route? Because that would give you information on what you need to be looking for with the compound. You also want to know what the clinical endpoints are, and these are measures that define your success. So with the compound that you're dosing, how will you know that you have achieved your end goal? If you know what it is you want to see in human beings, you can actually start to look for it in animals. And even though we discount animal data for the most part, most of the time when we do these studies, we do find that whatever we see in animal studies is reflected in human systems. And last but not least, you want to know what your market outlook will look like. And this is important because if the market outlook is not favorable, then you need to understand how much money you can invest reasonably without making a loss, or where you can draw funds from in order to support your program, even though you do not expect to make a lot of money. So for example, in this case that we're looking at right now, this was an antibiotic program, and antibiotics do not make money for the drug companies. But see, because the government is invested in public health, they do help with developing these products. So if you understand each of these bullet points and the marketability of that drug, you can approach the government when they are looking for plug-in drugs that they can use for public health purposes, and you can develop a drug using grant funding, etc., to facilitate or to bring a new product to market. So when you're looking at product description, you always want to include the product name, include the scientific name, the trade name, assign a product number as a group You want to identify the product class. You also want to have a high-level presentation of the mechanism of action. If you can define these points, you would be able to then begin to identify issues with liability. In this case, this compound was a quinolone, which is a group of drugs that already exist in the marketplace, and they were used for they're antibiotics of the aminoglycoside kind. And so these drugs are out there in the marketplace already, but this particular compound or the chemical structure was new to the marketplace. So then you also need to identify the mechanism of action. And even though you do not know the exact mechanism of action of the compound that you have in your hands, you can look at what other mechanisms exist for the drugs that are already in the marketplace. So you need to identify in detail what that compound is going to look like. And in this case, it was an antibiotic. So you needed to actually characterize two living systems, the bacteria as well as a human cell. The human was for risk purposes, while the bacteria was for the efficacy endpoints. So the carcinogenesis, mutagenesis, impairment of fertility, these are key endpoints that you have to worry about when you're developing these drugs. The animal pharmacology is important because it provides a priori knowledge of what you can expect in the clinic. And even though it is not a given, it allows you to preempt steps and to do studies that will inform the process of the drug development. When you identify the indication, you want to understand the intended action of the drug, what is the mechanism of action that you expect to find, and whether this drug is going to be used alone or in conjunction with another therapy. You also want to know all the indications that you could bring to market with this drug. And why is that important? And this is important because the information you generate in a non-clinical program can help you to support multiple disease indications based on how you view it from the get-go. So if you understand what it is you're doing and how many paths you could go with it, you can develop one pre-IND package or one IND package that can support multiple indications. That would decrease the cost of your whole program development, and it would allow you to increase your output because, for example, in this case, we have 5 different indications that you could request the FDA to give you, and you can use the same data set to support an IND in all these indications. So then you would also want to, of course, determine the mechanism of action. That's a key metric that you must always carry with you as you go along. So identify additional indications, describe the timing for trials in addition to the disease, and the intended action and combination therapy possibilities where possible. So for example, for some diseases, we do actually have, you may be developing a new drug, but by itself, it's not as effective. And this we have seen with anti-cancer agents that are coming to market. They're biologics, and what's happening is they're not 100% effective by themselves, but when they are combined with old world chemical drugs, they are actually very effective. When you think about the population that you're looking at, you need to describe the individuals who would likely use this product. This is important because the different individuals require different plans. So when you're thinking about children, you have to have a set of studies that go into defining children, and that's because children are younger than adults. So there's a period in a child's life that they are still in development, and you have to consider all of those factors as you develop this new drug. You also need to understand whether the indications that you have selected for this population are appropriate. For example, children hardly get any urinary tract infections, while urinary tract infections would be very common among women. So you have to know your population and the disease profile. So kind of an epidemiological study to inform the process. Again, always query whether it's a combination or a conjunctive therapy that you're pursuing. You also have to understand the contraindications that may be necessary to think about as you develop your product. Why a contraindication? So if you're developing your compound for elderly individuals, you have to always worry about their renal function as well as their liver functions. And that's because older individuals have got reduced liver and renal functions. So if you're giving them drugs, you probably will not be giving them a similar dose to that which you would give to a 21-year-old individual. In the clinical pharmacology phase, of course, we are looking at the pharmacokinetic characterization. So in this case, we want to know what is our mechanism of action. That's our efficacy side, or the pharmacodynamics of the compound that you're developing. You also want to know the pharmacokinetic profile, and that's the behavior of the drug within the system. In a few slides, I'm going to show a couple of profiles that define the movement of a drug in a system and the things that you should be looking for. So among those studies are plasma binding, is the drug bound to plasma proteins, the bioavailability, so if you ingest it by mouth, how much of it actually gets into your body, how is it metabolized or broken down? Is it only metabolized in the liver, or is it also metabolized in the gut or in the renal system? And the excretion, what kind of excretory pathways are we thinking about? Is it going to be biliary or is it going to be renal? These are all questions that you want to ask yourself so that you're keenly aware of what it is you're dealing with. The dosing and administration, when you're developing the drug, you want to define the mode in which you're going to deliver the drug. If it's an IV drug, what are the things you must think about? You must think about tolerance. The drug must be sterile, one. The drug must be injectable so that it does not cause corrosion at the site of injection. If it's a tablet, do you want it as a capsule, or is it just going to be a tablet, normally formulated tablet, or is it going to be a liquid? Those are things you think about ahead of time, because your toxicology studies must be conducted with a formulation similar to the one you will put in the clinic. And that's because the formulation can change the PK parameters of a drug. The dose and the strength of the compound must also be accounted for. And so in this case, we are looking at how are we going to formulate this compound? How is it going to, how will the formulation affect the kinetics of the compound as it goes through our bodies? The endpoints that you're going to be looking at. So what are the most significant endpoint with an infectious disease? And this was an infectious disease program. You have to worry about morbidity and mortality. So the one goal that this drug had to achieve was to decrease morbidity and mortality and decrease the quality of life, so that the individual who was infected with the bug does not have to continue getting infected. So if you can clear the bacterial load from the body, then that means that this disease will not be coming back again. The last part was clear lungs, and with this particular disease, the individuals would have mucus in their lungs, and if they can't clear it out, they can't breathe, and therefore the quality of life was lowered. So with each drug you're developing, you need to be able to articulate to the FDA what it is that you're expecting what is the perfect outcome for this compound, and what is the minimum that you must get with it so that they can allow you to proceed. Because with the drug development, it's all about the efficacy or the ability to improve human life that counts the most with minimum risks. Of course, with the marketability, You want to look at the indications you're going after. So which disease conditions will you be able to treat? How much money can you make from each of those indications? This helps. It helps in, it's not just about profit, but rather putting money where the best value is. So you want to know how many people are affected by this drug. You want to know how, what is the cost of taking care of individuals with this kind of condition, so that when you're pitching benefit for this compound, you're saying, okay, if I have an oral drug that is available to people with complicated UTI, the quality of life will go up, the cost of disability will go down. You must be able to support it with all aspects, the financial, the quality of life, and everything that proves to whoever is analyzing this compound that it is actually a benefit to the patient population that is served.
Thank you for watching the first part of the webinar titled Pharmacology and Drug Distribution Studies to Support IND Submissions, where our speakers, Dr. Sol Bobst and Dr. Harriet Kamendi, discussed how to build a target product profile. Please be sure to view the second part of the webinar, where our speakers discuss ADME and drug distribution studies, as well as secondary pharmacology studies.